Today we're here with Dr. David Gifford, Chief Medical Officer of American Healthcare Association. Thanks for spending a few minutes with us.
It's my pleasure.
Now, tell me about the long-term care data cooperative.
Well, this is a really great opportunity where we're collecting the sort of clinical information from members' electronic medical records into a database that allows us to generate really timely, helpful reports back to them to figure out how to do care better, maybe help with the survey process, help with understanding what's going on. And then also we can do some much more timely sort of surveillance of the spread of infections to help with discussions with CDC, understand, vaccines and COVID, and then also allows us to partner with some academic researchers to ask what works. Everyone is really focused on sort of what doesn't work. We need to know what works, and that's what this is about.
That does sound like a good opportunity.
Yeah.
Is it only for AHCA members or others can participate? How do they get involved?
So no, anyone actually can participate. Right now it's for nursing homes. The vision is to add assisted living in the future. But yeah, you do not have to be an AHCA member. It's free to join. This is funded by the National Institute on Aging because they're interested in understanding what works in the nursing home. And they are shifting their tune to sort of fund research that asks what works rather than sort of why are things bad in nursing homes. So this is really an opportunity, I think, to help us figure out what's better. And they recognize that in order to do this, we had to be able to give these reports back to facilities and make them helpful for them.
And that's a really good point, that the facilities can then change their process based upon this data. Mm-hmm. So what are some of the data outcomes that facilities could expect, and what are some ways that connects to the care journey?
So when we have the electronic medical record data, we have data that's not available anywhere else. So we'll have vital signs, we'll have the medications, the lab data, and we'll have the observations that nursing is doing. So we can look at questions like about hypoglycemia, low blood pressure episodes that are related to falls. We can look at medications and in drug interactions and with people with renal function. We can look at falls issues. We can look at pressure ulcers. We could look at functional level issues. So there's a whole wide range that we can look at. We can also look at the traditional things. We could look much closer at why people are going to the emergency room. Why are people being hospitalized? We can look at those types of questions that right now all the measures come months to years later. Now we can generate these on a much more timely basis.
Well, that's impressive, the level that you can drill down to really get useful tips. And so if that's the small level of giving that information back to the facilities, what's the macro picture? What are we hoping to learn or find with the aggregate data and trends that might come from that?
Well, clearly we need to know more to help us do better in long-term care. And this gives us much more real-time data and a comprehensive look at the data that we didn't have before. It allows us to benchmark against other individuals and organizations, though we do not reveal the names of any of the facilities or any of the organizations in this process. But we can still benchmark against others. Mm-hmm. So that's a vision. I think the three reasons for using it is, one is give information directly back to the provider to help. The other is to help understand public health, the spread of infections, mm-hmm. which, with all the drug-resistant organisms, we're seeing more and more of that. And I think this came out with the pandemic, really. We didn't have a good window into what was happening. And you had CDC build NHSN, and it's a huge data collection burden problem. This makes that irrelevant, and we can adapt really quickly to it. Mm-hmm. And then researchers have never had access to clinical data to help understand what works. Mm-hmm. And so this changes the dynamic of the research. So I think this really helps us in those three ways.
I'm excited to hear what comes out of the data cooperative. Thank you for spending a few minutes with us. We really appreciate it.
My pleasure. Thanks so much.